everyone, I'm finally live after ages. How's everyone doing? Very good evening. Welcome to my live, and I'm super excited today to discuss so much about our oral health. Hello everyone who's joining in. Good evening and a very warm welcome. I am Garima Bhandari, yoga, wellness and image coach, and so happy to see everyone today on my live. It's been like ages ever since I've gone live, and I'm excited to have Dr. Ruby join in from Clove Dental today. And being in the yoga, fitness and wellness space, I have met so many people who have always been very enthusiastic about taking care of their physical health, working out, looking fit, losing weight, toning up their body, but what they completely neglect is their oral health. And today we're going to have a lot of discussion points on what is the preemptive and preventive care that we can do for our oral hygiene and also oral care, so that we don't have any long-term ailments or repercussions. So yeah, so welcome everyone who is joined in now, and I'm just gonna be back in a snap. So we have Dr. Ruby from Clove Dental India joining in with us, and once again a warm welcome to everyone who's joining in for my live today. So accept Dr. Ruby's request. Hello, good evening, Dr. Ruby. How are you? So nice to see you here.
Hi.
So, Dr. Ruby is a senior implantologist from Clove Dental Clinic, and she's here with us to give us a lot of insights on why oral hygiene is important, and so many points that I'm going to ask her. And I request also everyone that we're going to have a Q&A window towards the end, and also in between we'll take some questions. So if somebody has any specific questions, you're more than welcome to ask the doctor. She's here to answer everything for you. So welcome, doctor.
Thank you so much, Garima. Thank you.
So, doctor, my first question for you would be that what does it mean when a dentist says that it is so imperative to replace missing teeth, and why?
See, basically, we can have a tooth missing in the mouth because of a tooth removal that has been done because of decay or because of gum problem. So that results missing single tooth or multiple teeth. Now, replacing a missing tooth basically means providing an artificial substitute to where a natural tooth once stood. Why it is important? Basically, again, important to reverse the loss of function which happens because of missing teeth. Any tooth that is missing once helped you with chewing. It had some role to play in the mouth. So since it's missing, there is nothing to replace it or reverse the loss of function that is already happening. So yes, a missing tooth should be replaced to reverse the loss of function, to reverse any problems that are happening to the adjacent teeth. Because if there's one thing missing, the entire balance of the mouth just goes haywire. Teeth tend to tip into the position of the missing tooth, leading to tooth gaps and a lot of food lodgement. It, of course, affects our aesthetics. Wherever front teeth are missing or multiple teeth missing, leads to, an aging appearance. And, of course, coming to more technical, aspect, when a tooth goes missing in the mouth, the jawbone also shrinks. So that is one of the most important reasons why a missing tooth should be replaced.
Okay, thank you so much. And when we say missing tooth, so does that mean the entire tooth being missing, or is it like a partial loss also that is also important to address?
See, like I said, every tooth has a role to play in the mouth. Probably wisdom teeth are the only teeth which we do not replace once they are, or if they are not in the mouth at all. Apart from a wisdom tooth, so that makes like 32 minus 4. So the other 28 teeth are as important as they can be, and any tooth missing can lead to multiple problems. Of course, when there are more teeth missing, that means, the load on the remaining ones is more. We have seen patients who tend to chew only on one side of the jaw because, the other side of the jaw does not have enough teeth for chewing, which eventually leads to compromise in the remaining teeth as well. So it could be one tooth, teeth, or the entire jaw. We call it, that is, no teeth present in the mouth. So it could be either one of the cases. In any case, replacement is necessary.
Okay, so I think this answers my successive question, which was that why should I actually replace a missing teeth? So she has very nicely explained the reason for doing so. And what are the various options that you suggest and recommend that people should go in for this replacement?
Garima, broadly classified into two, which is replacing a missing tooth with a removable or a non-fixed replacement, or with a fixed.
Okay.
Those are the more conventional methods. We have seen our grandparents, and probably our parents or grandparents use them, which were like plastic plates getting jawbone, and with acrylic or plastic teeth. Could be again plastic or metal. So they are removable in the sense the patient can remove and replace them in the mouth. Very basic. They, yes, do replace the teeth, but they do not hold on to the bone, and the kind of comfort and function that we would want is obviously not gained by a removable replacement. The other option is fixed replacement of missing teeth, which again can be done in two. Again, the more conventional method, which has been like in dentistry for the last century or two, has been with bridges, which means we take support of the adjacent teeth and then put caps on those teeth to replace the part of the jawbone which is missing. That is one option. And then again, there are dental implants, which
Okay.
has been into dentistry for, again, almost a century, in India for probably the last couple of decades. But now is the time when people are accepting it more as a means of replacing a missing tooth. So dental implant is the fixed replacement for a missing tooth, and the closest that we've been able to, go to simulate a missing tooth.
Okay. Okay. Wonderful. My next question, doctor, is that why should I get an implant and not just a simple cap, which is the crown and the bridge? And before you answer this question, I would like to request all the audience that you can please come up with your questions and direct them directly to Dr. Ruby here, who's here from Clove Dental India, to answer all your queries related to your oral hygiene and oral what do you call rectification. So she's right here. You can ask her all the questions. So yeah, coming back to our questions, that why should I get an implant and not just a simple cap?
See, a simple cap, like again I said, basically involves, for a normal, for a bridge, do require support of the, but a dental implant means we implant the implant into the jawbone. So that does not replace only the function, it also helps conserve the bone. It is something like, a very common term people would be familiar with is disuse atrophy. Any part of the body or anything that is left unused eventually tends to go into atrophy, shrink in size, and become worthless. So that is what happens even to our jawbone. If a tooth goes missing, the jawbone also starts to shrink, which again is reversed by placing a dental implant. So it, of course, helps with what a teeth should be helping with, plus it also conserves our jawbone. So that is why that is
Okay.
a superior way of replacement than going in for a bridge.
So much that actually goes into it. Most of people think that oral care is only for the aesthetic reasons, but it's actually the long term that nobody sees and looks into. So that's like so insightful to know all this. Okay, doctor, my next question would be that how is Clove Dental a good place for getting implants done? What is your USP there?
See, Clove is an organization. Again, we are the biggest chain of dental clinics in the country, which again obviously means that we have a strong team of surgeons and implantologists with several years of experience and thousands of implant surgeries, like put together. So all the treatments that are done in Clove are transparent, and we keep meticulous records. So basically, due to all of this and our internal programs and case discussions and knowledge sharing, of course, skill, the chances of failure is bare minimum. It is,
Okay.
hardly any compared to, if you would go in to any other place or a private. I wouldn't say that we have seen, great work done by private dentists and other dental chains, but Clove as a team has such a, the storehouse of knowledge is so much, and the number of cases and the experience is so much that it is very hard to actually go wrong with Clove.
Wow. So I hope everyone's listening to Dr. Ruby here, who says that why you should visit Clove for all your dental requirements. Ma'am, Abhishek Sharma has a question that, ma'am, I want to know about oral correction at the age of 30, if I'm able to understand his question correctly. Oral resurrection at the age of 30. So are you able to follow the question, doctor?
That's a very broad term. Oral correction could
Yeah.
be any of the multiple dental treatments that involves, but be it 30, 40, or 10, even 80, see, age is no bar to any kind of a
Yes.
dental, whether it be dental implants or even orthodontics. So what we do see in implant surgeries is that if there is a medical condition that is involved, that should be under control, that should be managed by medication. Because again, old age, or there is no, basically contraindication in terms of age. Because of course,
Yes.
we would require more dental treatment as we age, because that is the time when we would probably tend to lose our teeth, or like
I got my milk tooth removed last year at the age of 39. Two of them. Yeah, behind the canine.
oh, the extra teeth.
Yes, they were like behind, so there was no place for the canines to come out, and finally they are showing now. I would say crowning. So yeah, as you said, just got reminded because you said age is no bar for such treatments, and I knew that later on it could be more hitherto if I don't get it done now. So aesthetically also I've been procrastinating it, but I'm so glad I finally took the plunge, and I feel more good, I feel more nice, I'm able to chew better, everything is better, fall better.
See, that is true because, again, function, aesthetics, diet, that is one of the big things. Do not
Yes.
have, if you do not have proper chewing, your diet is compromised. That, you know, in turn compromises your general health.
Yeah.
Also, if you are already diabetic or hypertensive or have heart trouble and you have problems eating, then your general health also suffers. So that is how, we say that your oral health or your mouth is the window to your general health. So that is
Yes.
how replacing dental and dental implants.
Great. Let me take one more quickly, one question. Dr. Pulak Mishra is asking that can young people get an implant treatment?
See, Garima, again, young people, we usually would not avoid to do, we would not advise to do implants as a surgical procedure. Very young people, that is children, because they still have growth spurts. So once the growth spurts, which us is sooner, the growth spurts end sooner for girls than for boys. But done implants for children as early as say about 14, 16, 18 years of age, but not younger than that. It all depends on how their growth phase is, because also leads to jaw bone modulation, right? The bone remodeling also happens.
Yep.
The other day, we year-old child. We have to make the patient understand that there could be some changes which might require some modifications to the treatment or to the cap we place over the implant because of the normal remodeling or the jaw growth. But young that obviously in children or in very small kids, dental implants are usually not indicated. because anyway, our full complement of teeth only supposed to come by 12, 13 years of age. So that only after that do we see replace missing teeth or teeth which require extractions. So I would say there is, yes, a certain age after which we should be thinking of dental implants, but there is no higher limit.
Okay. Mm-hmm.
Because we have more patients in this higher limit. Of course, in children we have a little vary about what outcomes we are looking for.
There's another question for you, doctor, from RT. It says that, is there any age limit to get an oral implant done for baby teeth that is not removed totally? Naturally, sorry, not totally.
I didn't get baby tooth in an.
She's saying that, is there any age limit to get an implant done if the baby teeth is not removed naturally on its own?
No. Like I said, no age limit. Of course, there should be jawbone. So if that we really do a complete examination and take radiographs, X-ray, check for the jawbone. So as long as there is jawbone, there is no age limit, any kind of other absolute contraindication to implants.
Right. And Lalita Rawat is asking that, what is the basic cost of brace implant?
No, braces is, I think they're just confused. That's an entirely different dental
procedure. Mm-hmm.
But still, if you would want to know, braces, again, there are different kinds of braces treatments, starting from fixed to aligners and whatever. So the cost and all of that is available on our website, so they can definitely go and check on that.
And Ketiki Bihari is asking that, is getting implants painful?
Not at all. I would say dentistry is not painful at all. Dental disease is painful.
Yes.
The dental implants are done, it's a minor surgical procedure done under local anesthesia. So once local anesthesia basically means that we numb the part of the mouth wherein we are supposed to place the implant. Mm-hmm. Post the procedure, you will usually be prescribed some kind of or painkillers for 3 to 5 days, depending again upon the extent of the surgery, whether it's a single tooth replacement or multiple teeth or whatever. It is not painful at all. Lifting off some amount of swelling or discomfort is a normal sequelae after any surgical procedure. Like I tell my patients, even if you get a scratch on your hand, that swells up. So of course, if you get a minor surgical procedure done in the mouth, there will be certain do's and don'ts.
Discomfort. Yeah.
Some discomfort, some eating precautions, but that's about it. No long-term effects, and no, it is not painful. It's the local anesthesia, which means numbing of that part of the jaw where we place the dental implant.
Thank you, Hemdev Kanchan. Hi, how are you? She says, way to go. It's very informative. And she's also asking that, what is the correct age to wear braces to align teeth in teenagers?
We are again not talking about it, but that's okay. See, again, there is your dentist will tell you the correct age. About 6 to 7 to 8 years is the age where the milk teeth start dropping out and permanent teeth come in. More conventional way of thinking was that let all the permanent teeth settle into the mouth, and that is when braces should be placed, which is at about something around 12 years of age. But nowadays we have so much of interventional dentistry available, wherein we can intervene at an early age and prevent the malocclusion or the teeth from getting too deranged. So that could be at 8 years of age, 9 years, 10 years. There are habit breaking appliances for children who have thumb sucking or tongue thrusting habits. So all of that is something that your dentist have to see and tell you. So there is no real age limit for even correction of developing teeth.
Okay. So Kanchan again has a question. She says that, when and why would you suggest an implant to a patient?
any patient who has a missing tooth or a tooth which cannot be saved by treatment. At times we see patients who have decayed teeth with just one wall of the tooth and they're still, trying to chew with that, or, they don't have a tooth missing, but it's totally decayed and still lying in the mouth. So these are, the things which again affect not just, like I mentioned even before, not that part of the jaw, but even the adjacent teeth. Because the teeth will have a tendency to move if they are not upper. If a lower jaw tooth is missing and upper jaw, tooth is there, it will tend to come down, or the teeth will, tend to shift, leading to gaps between the healthy teeth as well, which eventually leads to food lodgement and decay and all of those problems. So that any kind of a missing tooth or a tooth which cannot be fixed by treatment should be replaced.
Thank you so much. I hope that answers your question, Kanchan. And she's saying sorry for the irrelevant question. So no question is irrelevant. Doctor's here to happily answer them for you. She's been very patient. And meanwhile, I request each and everyone to please come up with questions, since doctor is here exclusively live with us right now. There is another question which says that, ma'am, I have milk teeth, which I can't read after that. What is
Which,
the, I don't know, there's a line which is there, I can't read that, which after which, what is the best solution for it?
see, like milk teeth which are still there and a permanent tooth is somewhere in the jawbone, it can, after of course an evaluation, there is always an option to correct it with some kind of an orthodontic treatment, whether it be braces or aligners. Yes, that's long term, but if a natural tooth is in a position wherein it can be brought into where it should have been, so that is
Right.
one thing we first try to do. Of course, if that is not an option, and sometimes we have congenitally missing teeth, which means that the teeth never formed in the jawbone at all. There are cases like that as well, which again leads to primary teeth, that is milk teeth still present. So in those cases, if we have good jawbone, which we usually do, the adjacent teeth and all are proper, then we can go in for dental implants in those cases. Because a milk tooth, even if it is retained, will not last you all your life, because they are inherently smaller. Their anatomy, their morphology, their shape is different from the permanent or the adult teeth. So they cannot really take up that much load, and they will not last you, your entire lifetime. We see patients probably in their 20s or 30s who usually report with milk teeth which have now become loose. So that is the time when we, intervene, remove those, and then dental implants to replace the space.
Somebody is asking about teeth whitening options. And there's another question which say by Kanchan again, that are there any maximum number of implants that can be done to avoid uh, decay?
Dentures in aged patients.
Dentures in aged patients, yeah.
What he is asking is to avoid dentures. Yes, there is a minimum and maximum number of implants, but again, ma'am, there should be enough jawbone. We have now come up with, other treatment modalities wherein even in compromised jawbone, we are able to give fixed treatment options, which again, like what she means is to avoid dentures altogether. So yes, each and every case can be managed with dental implants. We have variations. Of course, if we have good amount of jawbone, the treatment prognosis and the years, the implant can serve you, of course, increases. But yes, there are dental options, there are implant options wherein you can, just like we can remove the need for altogether. That's the removable, we can just remove that option altogether.
Right. There's another question which says that for teething issues, infants and for kids 6 to 8 months who don't sleep cause of discomfort, what can we do for it? Teething issues for infants. So we have moms, new moms, older kids moms, everyone here.
Again, this is something that should best be discussed by pediatric dentist or your pediatrician also, because they are, would be to answer this question better than me.
Okay, so let's move on to my question for you. That can anybody get an implant, like at all ages? Oh yeah, we discussed this one. So if I get a crown and bridge, then am I at a loss?
Yes, definitely. See, a crown should ideally be done only where it is advised. After, say, after root canal treatments is where we advise crowns, or in teeth where they are discolored, or their shape is not how they should be, or there are certain kinds of hereditary,
Like half broken
half,
also.
half broken, so crowns and veneers for those cases. Bridges or crowns just to replace a missing tooth would mean that in most likelihood we are taking support of the adjacent healthy teeth, for which we have to modify those as well. We have to probably shape them off, cut them off a bit, so that they can take the load of the cap or the bridge. So yes, that definitely affects, and you are at a loss if you are actually touching your natural teeth which did not require a treatment in the first place. That is one thing. Plus the bone loss, like again I spoke about it before, a bridge would not prevent bone loss in the area where a tooth is missing. So can we see that a patient, they have bridges in the mouth which are, some say, 10 years, 15 years, like old. And now that the bridge has given away, because the support from which, the teeth which are supporting the bridge, they themselves are decayed or loose or whatever. But the missing teeth space also at times does not have enough bone, or does not have as much bone as we would, like for us to place the implant. So that happened because a timely replacement or an implant wasn't done, or wasn't an option.
That
So
time.
now that you have an option, you should obviously hands down go in for a dental implant wherever it can be done. There are again certain cases, certain areas of the mouth where the dentist would not advise a dental implant for whatever reason. But again, he's the best person to decide that for you. But a crown and bridge just to replace a missing tooth is something that we would not advise if bone is available for.
Okay. So what about in the case of a half missing tooth? So for that, there can be an implant for that, or is it just the crown?
A half missing tooth depends on what is the health of the remaining half. If it's
Okay.
just which is broken on top with a healthy root, then in most likelihood we can save that tooth itself with a cap or a partial cap, a crown or a partial crown, which is called a veneer, dental veneers,
Yeah.
along with the root canal therapy. So if the remaining part of the tooth and the root is in good health, or even
Only
if
then it can be done. Okay.
but can be treated, then of course we would not advise removal of it. A dental implant is advised wherein the part that is remaining is also not in
Also
a great,
gone.
also gone, is probably the decay is beyond repair, or the fracture is even in the root level. So that is the time when we would actually advise for removal of the tooth, followed by.
Right. Thank you, Shine, Sony, for such beautiful words. Thank you for joining in. And if you guys have any questions related to dental implants, please be here. Dr. Ruby is here with us from Clove Dental for this exclusive live, and she's sharing some beautiful insights on why it is imperative to get an implant done and why you should not be frightened by it. So doctor, talking about the implant, how long is the procedure and how much time does it take to actually do it? And are there multiple sittings to do it, or does it happen just once?
See, the procedure for placing the dental implant in the jawbone is usually a single sitting procedure.
Okay.
That again depends on if it's a single implant place. So it can take as less as 10 to 15 minutes to complete the entire procedure. Of course, if it is placement of multiple implants or involves first removal of the bad teeth and then implanting, and we are taking it up as a single procedure, then it can take longer, maybe an hour or a couple of hours to the maximum. And as far as the timeline goes, which means placement of implant and rehabilitation, that is giving the crown over it. For back teeth, it usually the procedure would require say about 3 to 4 months for replacing a single or a two natural teeth in the posterior jaw, which is the for front teeth. We are able to give you a temporary crown even in a day. Then there are certain newer implant systems which are coming up, which can give you a rehabilitation of the entire jaw within a week or 10 days also. So it is quite variable, but like I said, it like in a root canal treatment, which is done over a single sitting or multiple sittings. In a dental implant, the surgical procedure itself is usually a single sitting procedure. The rehabilitation may take longer, again depending on the case, and the duration of the sitting may range from 10 to 15 minutes for a single implant to say about 60 to 90 minutes if more teeth or a full arch.
Right. So, doctor, there's another question by Oja Vipul, which is that which toothpaste is better for teeth whitening, Clove Sensitive or Power? Which one do you recommend?
Both these toothpaste not really have bleaching whitening agents. I would say Clove Sensitive. Any toothpaste used for sensitivity has more concentration of agents, which reduce the sensitivity in the mouth. But again, either of these toothpaste or any other over-the-counter toothpaste that you will get will not really whiten your teeth to a very great extent. What you can do to keep your teeth, better or cleaner is go in for regular prophylaxis, that is scaling or cleaning and polishing by your dentist. And for long-term results, there are other in-house whitening treatments that the dentist will do. There are use of whitening agents, use of laser to whiten teeth, use of certain kind of chemicals, of course, safe for use in, which will actually bring down the tooth shade to a much lighter version, and the effect stays for long term. Toothpastes, even the ones that are, claim that they are for whitening, have these chemicals, but in very low concentration. So the effect would not really be what you would be looking for. But there are multiple safe dental whitening options. So, and your dentist can help you with.
So when you say lasting, so how long does it actually last?
The teeth whitening can last up to 8 to 10 months to a year. A lot depends how you also maintain, like,
oral hygiene.
We take a lot of haldi, or somebody who is fond of red wine, or some smokes. So therein the tooth whitening results will not stay for a while, because these are the things that tend to stay in teeth. But if you're taking care, you're brushing, rinsing after taking lesser colored food products, lesser red wine, so the teeth whitening results stay for longer.
Thank you, doctor. So Muha is asking that is bone graft necessary in every implant?
It is not necessary in every implant. It depends on the case and depends on the site of the mouth. If your dentist thinks that there is enough bone present wherein we can avoid the use of bone graft, we would not use it. Sometimes it immediate implant. By that I mean that we need to extract the tooth and place an implant immediately. There is where we usually require kind of a bone graft, because the tooth that we've removed and the size not match. So that is the time we require use of bone graft. And use of bone graft is done to augment the bone formation around the entire, the treatment. Basically, the rationing, the dental implants that we use, they tend to integrate with the bone. It's not a physical connection, it's a biomechanical connection. So for that, good bone needs to form around the dentist. So wherever your dentist feels that a bone graft will enhance that bone formation, that is the time only where a bone graft will be needed.
Okay, so next question is by Shine Soni, who says, how can I get a flawless smile as I'm going to be representing India International pageant, looking for a dental consultation for the same? So you must visit Dr. Ruby at Clove Dental, and she will make sure that you have a flawless, mesmerizing smile, give you a smile makeover so that you bring the crown back to our country. I hope that answers your question, Shine. And would you like to add anything to it, Dr. Ruby?
She knows what she has to do. Take a consultation. Your dentist will help you whatever is required for you. At times we think that there's a lot of a lot going on in a mouth, and it's probably single session of cleaning which might actually alleviate your problems. And again, there are times where we see that something is wrong with our mouth, and we go for a dental examination. So many things which are hidden. Even us, this dentistry is something wherein you are dependent on the other person, on your dentist to see and tell you, because it's not a wound on the skin where you can visualize. That is the reason why we advise regular periodic dental checkups, because something happening in the back of your mouth, you'll not be able to see it with the naked eye, or also probably require an X-ray or a dentist to have a look at it clinically before they can tell you what is required for dental. Also, one more thing that I keep telling my patients is implants is the way of replacing a missing tooth. But we come to that problem because we do not, take care of smaller issues.
Okay.
Then they're not like fever that we take medicine, or small infection that can first. Dental issues in most likely intervention. They do not cavities by themselves. A root canal, if a tooth requires a root canal treatment, it will not be reversed by medication. Intervention and treatment is necessary. So, and dentistry, again, one more myth, dentistry is expensive. Dentistry is not expensive.
Yeah, that's a very big myth.
And if you catch a problem in its most minute form, then it is very reasonable. So those are a couple of things which I would, want to share with people through your forum. That
As a layman, I would like to ask, I'm sure many people have this question, that how many times do you think in a year one should frequent the dental clinics, even if their oral hygiene is good, they don't have cavities, but the preemptive regular checkup, how often should it be?
it should be every 6 months, Garima, twice a year, what we recommend. If your is meticulous and your dentist himself tells you that you can manage once a year, well and good. Otherwise, twice a year, what we would recommend for patients who've had a lot of dental work done in their mouth, whether it be implants, crown bridges, or RCTs, whatever. At times, we may want to see them sooner, probably.
Okay.
So, again, this is what I usually prescribe my patients once in 6 months. For somebody who has had a lot of dental work done, once in 4 months, and someone who is anyway regular without any cavity and with very good oral hygiene, you can even manage to go once in a year to get regular cleaning. So that is advised.
Nice. Thank you, doctor. Aditya is asking how to make your teeth stronger.
How to make your teeth stronger? Clean them, brush twice, rinse after meals, floss whenever it's advised, visit your dentist regularly. Avoid too much starchy, sticky food. Have a lot of, raw vegetables and salads and fruits. So these are the things that I would advise to keep your teeth healthy. And of course, take care of your general health. Take care of your general health, your calcium and your vitamin D levels. Because that is something that can affect your job as well.
Okay, so Kanchan is asking that how many implants can be done in one particular sitting, please?
Again, depending on the kind of dental implant modality that we are going for, we have done about 10 to 12 implants, or even more than that, in a single sitting, wherever the entire jawbone is like the teeth are the entire jawbone, upper and lower. We have done 12, 14 implants also. And also it depends on how the patient can take, because some patients at an advanced, it's difficult for them to keep their mouth open for a very long time. That wherein we customize the treatment according to our needs as well. At times we have good jawbone and everything, but may not be able to keep them for a very long time, or there may be certain other physical illnesses or physical restraints to the patient. So that is when where we can break the treatment into multiple sittings as well. But if you talk about the maximum implants that can be done, 14 can be done, if, of course.
Right. Moha has a question that what makes difference in good and bad implant? I think he's trying to ask that how can you judge that this is a good work done and this is a bad work?
This is again something which, has clinical expertise which might be required for a
Okay,
patient,
after examination.
for a patient to judge whether, I don't know if what they mean by this, but if it's about a surgery, then you should be fairly comfortable after your surgical procedure. But like I said, some amount of pain, swelling, and all is expected after the procedure. After the rehabilitation, after the crowns, you should be able to eat better. There shouldn't be, any signs of infection in the mouth. That is something that you would, understand, or that's something that you can use to like gauge whether your implant is being done well or not. But of course, seeing the X-ray or that technical thing, so I uh, do not feel that some non-dentists may be able to actually judge that.
So Kanchan is asking that post implants, what is the routine to be followed in terms of checkups and other visits that should be done to take care of the implant?
After the dental implant, if we are going ahead with the rehab of the implant, like I told you before, after 3 to 4 months, after your dental implant, usually the dentist would want to take, if at all, after the surgery, some stitches and all have been given. So after a week or 10, then every month or month and a half is what we advise for a check. We take an X-ray of the implant to see that everything is going as planned, that the bone is healing around how we want it to be. After we have given you a crown or cap over the implant, that is a tooth over your implant, we would again want first visit to be probably after 3 to 4 weeks to again understand that force and the bite balanced, and it is how we actually wanted it to be. And if after that every 6 months is the minimum, it's the like this, that is what you shouldn't go more than 6 months without a dental checkup after a dental checkup is what I would say. Because there are a lot of times where, you know, uh, we have seen patients in our own practice, unfortunately, where they have come to us for years together, and then they come with some problems which could have been saved even
Better.
had they, been regular with their checkup. So 6 months is what I suggest is a regular follow-up.
I remember when the lockdown happened for the first time in Delhi, the very first lockdown, I had a similar life with a dentist, a doctor, and there were so many people who had so many dental issues and nobody to have the redressal from, and even the doctor said that perhaps people think that the entire nation is there to only save the lives of people who have COVID, but it's a misnomer. The amount of uh, problems people have in their dental thing is unimaginable. So I'm working like there is no lockdown for me. I have to go every day because there's such serious issues which earlier people neglected, but now since they're home and it's showings and it is lockdown, they can't go. So as you were saying that it is very important to be regular and not keep neglecting. How if you have a heart issue, we immediately rush to the doctor. We have fever, we'll take care of it. We have abdominal issues, we'll take care of whether it's constipation, diarrhea. But when it comes to even skin and hair, we address. But when it comes to ठीक है ये तो ठीक हो जाएगा, it must just be a pain, so we keep like procrastinating it, and we should not do that. So Kanchan is saying that extremely informative, insightful, and beautifully curated session, Garima. This was remarkable. Thank you everyone for joining us and joining today with Dr. Ruby from Clove Dental Clinic. Thank you everyone. And Doctor, I have a last question for you. That why is it so special about getting implant and crown only at Clove Dental? For the ones who join in later, please mention about that.
Like I mentioned even before, the the year experience and the and number of implants that we've done together as a team in Clove is surpassed. No other dental chain, no other dental clinic boasts of so many cases. We have, like constant case discussions and reviews, so failure rate is at a bare minimum. Plus the quality of treatment that we provide and our record keeping, again, that sitting here, if you're sitting in Delhi and you have to go to, say, Jaipur or Chandigarh for some reason, your records can be seen there, your dental implant records or your other treatment records visualized there, and you can continue your treatment. So the movement between cities or between clinics is seamless for your treatment. Okay. The sterilization that we follow in Clove, again, is even in COVID, like you said, the first lockdown, we were probably the only dentists who were working throughout the lockdown and who started being fully operational, seeing all kinds of patients and working full time. We were the first ones to do that because we had confidence
Wow.
in our sterilization protocols, in our equipment, and we had special aerosol suction units and the kind of fumigation that we follow. So that basically again enhances the quality of treatment and the minimizes the risk of infection. Then comes the authenticity. We are again not a single, like dental clinic or a couple of clinics. We are a brand. So we know our implants and our patients have trust that our implants are authentic, our treatments are authentic, because all of us, get all of it together. It's not just, we provide our patients with information, with implant stickers, with all the documents which tell you the products used in your mouth are genuine. Then we have fantastic lab support, which is again very imperative to, for rehabilitation of implants. So that is why Clove is the best place where you can go ahead with your dental implant and crown.
Yay, I'm super pepped up. I've already, placed my appointment for Tuesday because I was told over the phone that Monday you guys are shut down. So Tuesday is when I am going, guys, to get my dental work done. I'm visiting the Clove Dental Clinic, and thank you everyone for joining in. Neha says doctors at Clove are very, very courteous. I could totally tell and second that after this wonderful, insightful conversation with Dr. Ruby. Thank you everyone. Thank you, doctor, for joining it. It was a wonderful conversation today. And those of you who missed out this conversation, I'm going to be posting this video on my feed. So go tell your friends. And there's some fabulous questions that have been answered by Dr. Ruby. So you can check out and save this video for later. Bye for now.
Thank you. Thank you so much for having me.
Bye. It was a pleasure. Goodbye.